Hi Kinds, welcome back to our channel Be Kind. My name is Shrey and in this video we'll talk about a topic which affects everybody's life living in Canada, and that is Canadian healthcare system. Last year we made a video about pros and cons of living in Canada as PRs, and one topic which we covered then was healthcare. We talked about the long wait times, but we didn't really deep dive into that topic. Today, after having spent almost 18 months living in Canada and having experienced healthcare from a very close standpoint, which involved finding a family doctor for both me and my wife, going to our family doctors for routine visits, and also visiting the ER on an emergency basis, I think now is a good time to talk about Canadian healthcare system and some of its pros and cons, which will affect all of you. So in essence, Canadian healthcare system is a public insurance system, which means that the insurance is provided by government, both federal and provincial. Each of the 13 provinces and territories in Canada have their own healthcare plan, but they all run on a centrally driven health act which ensures consistency amongst the various healthcare systems. In Ontario, the health program is called Ontario Health Insurance Program, also called OHIP, and everybody living in Canada as a PR or a Canadian citizen has access to it with a OHIP card. If you come new to Canada, that's the first thing that you should do, is to get an OHIP card which gives you access to healthcare for free in Canada. But not everything is covered under OHIP plan. Things like dentistry, including prescribed medicines or voluntary surgeries, are not covered under the public insurance program, and for that most Canadians who are employed with their jobs have a private healthcare plan. In case you work in a job where you don't have a conventional employer, you may need to buy a private plan to cover these aspects which are not medically necessary, but your everyday visits to the doctor and any surgery or procedure that the doctor thinks is medically necessary to improve your quality of life is covered by public insurance, and you won't need to spend any money to get those services. And the second key aspect of Canadian healthcare system is that it is accessible to all and consistent for everyone. So what it means is that all family doctors practicing in Ontario have the same standard of care that they offer to their patients, and everybody has access to the same resources. It's not like in India where if you are a wealthy individual, you can go to a better hospital, and if you are below poverty line, you would have to go to a substandard hospital. So here all hospitals are accessible to all and they offer consistent standard of care. This healthcare system, which was designed 60 years ago, is come at a point where, because everything is free, and with the recent influx of immigrants coming in to Canada over the last few years, it has increased the wait time of these services a lot. Fraser Institute publishes annual reports on the wait times of Canadian healthcare system, and it will tell you that on average it takes about 27 weeks or almost 6 months to go from a visit to a general practitioner to getting your treatment, which is a really big wait time and amongst the highest in any industrialized country. And you can also see that the wait times have increased a lot compared to what it was back in 1990s or even early 2000s. And another aspect of wait time is finding a family doctor for yourself. And that is the first thing that I want to talk about from our experience of Canadian healthcare. When we moved to Canada, we started looking for family doctors by various resources available online, like Google, to find a list of family doctors within our area, and we started calling them, and most of the clinics were not open to accepting new patients. We also use government services which help you to match with healthcare practitioners around the city, but that wasn't giving us a lot of success either. So after trying for almost 6 months, we gave up and we thought that for now we will only go to a walk-in clinic, which means that you are not tied to that family doctor, and a walk-in clinic is open to treating new patients. The difference between a family doctor and a walk-in clinic is a family doctor will have your entire history and you will go to the same doctor, so they will know what has been your scenario ever since they start looking at you. But a walk-in clinic is more like a one-to-one engagement, and that day you are meeting with a doctor who may not have your entire history. So it's not ideal to go to a walk-in clinic, but if you don't have a family doctor, then that's a good alternative instead of directly going to ER. So the first time our interaction happened with Canadian healthcare system was when I had a small pimple under my eye and I needed to go to a walk-in clinic. So I called a few walk-in clinics and got an appointment, and when I reached there was approximately 30 to 40 minutes of wait, even though I had booked an appointment. But when I met the doctor was really professional and he understood the issue and he prescribed a medicine to treat my infection. But we then asked him him if he's accepting new patients. And thankfully he said yes, that he's accepting new patients, and on that day we signed up as patients of that family doctor. After about 2 weeks, we went for a meet and greet with the doctor where they did some initial tests of ours, and they also asked us if we had any concerns or prior medical history. So all that happened on the first meet and greet, which is a really good opportunity for the doctor to know about your medical history and to prescribe any tests that they feel are medically necessary for them to improve your quality of life. There were few tests that the doctor asked us to do, and in that case they issue a requisition slip. It's like a requisition slip which tells which tests are required for which patient, and then that requisition slip we have to take to any of the lab or diagnostic centers and get those tests done. For lab tests, we went to this service called Life Labs, which is prevalent all across the city. We have many life labs within our neighborhood itself, and we could just book an appointment with them over the call or sometimes also online. And then when we went to Life Labs, the process was really smooth. Everybody was really friendly, and some of the blood work that we had to get done, everything happened on time. And sometimes the reports directly come to the patients. They will give you an access key and a website where you can look at your report online, but most of the times the reports are directly sent to the doctor, and the doctor will then call you to discuss the results of your reports. And while for your blood work you have Life Labs, if you want to get any diagnostic tests done like an X-ray or an ultrasound, which I needed to get because I got injured while playing cricket, there is Ontario Diagnostic Centre, which is also available across the city. You can go there with your requisition slip and they will do your X-ray or ultrasound, and most of the times the reports are available by the same day or maybe within just a couple of days. Or there are other diagnostic centers available as well where you can speak to your doctor and go there. But overall, in our experience, once you have a family doctor, life in Canada from a healthcare perspective is much easier because they know your history and you can form a connection or a bond with them, and they understand you and they can really take care of you in a very professional and friendly manner. That has been our experience of finding a doctor and also our continued interactions with the family doctor. So the only thing that we had to pay for is the prescription medicines that were prescribed, but even for them we have a private insurance through our employer, and we were able to bill our prescription medicine cost to that insurer. We really didn't have to pay much out of pocket for using any of the healthcare services, and that is the benefit of living in a developed country where the taxes that you're paying from your income is being used to give you back these services so that you don't have to pay for healthcare out of your own pocket. So the last aspect about Canadian healthcare system is the emergency hospitals, and with the increased immigrant population coming into Canada, coupled with the fact that there is a labor shortage for nursing staff and healthcare practitioners in the country, there is a long wait time also in emergency hospitals. And so what hospitals do is they will do a triage system, which means that when you visit an ER facility, your needs will be assessed and they will be prioritized on the basis of how urgently is your requirement of medical need compared to everybody else that is visiting the ER at the same time. For example, if I visit the ER facility with a broken foot and there is a person that comes after me, but somebody that's having maybe a seizure, the person that has come after me will be prioritized because that person needs medical health much more urgently than I do. What that leads to sometimes is a person visiting an ER facility with something which is really painful, like a broken foot, but it's not medically urgent in the eyes of the doctor. You would have to wait to get your turn, and sometimes that can take a toll because you would have to spend 6 to 8 hours and you are waiting there while being in pain, and you are seeing other patients who have come after you being treated earlier than you. But I think until we have something better, this system works, and it does ensure that when you have a medical need which is truly important and urgent, you will also be prioritized. If in case I have to go to an emergency hospital and my medical needs are much more urgent and I need care right there and then, otherwise it will be a matter of life and death, I know that my needs will be prioritized over the needs of others. And that system has worked well so far in Canada, but sometimes it can lead to increased wait times. So we have had both these experiences while visiting the ER in Canada. Once we needed to to access healthcare immediately, and we were given that within like 10 minutes. But on the other time, when we went back for a revisit and checkup, we had to wait after doing our tests, and we were asked to wait for like 2 to 3 hours to just get the report. So we have been on both ends of the healthcare spectrum, but I think from an overall standpoint, Canadian healthcare does its job of protecting its citizens in the times of urgent medical needs, and there is also an increased emphasis and infrastructure by the government of Canada and also the various provinces to cut down on the wait times by spending more on training of staff to fill the labor shortages. And there's also a plan by some of the provinces to include private healthcare also as a way. So this was recently said by Doug Ford, who's the Ontario Premier, that they're also looking to expand the healthcare to some of the private hospitals. We don't know whether that will happen, but there is definitely a lot of scrutiny on Canadian healthcare system. But so far, it has been able to do its job and protect its citizens when they are in need. So another thing that we did in the ER while we were waiting for our reports, we asked on a scale of 1 to 10 how severe is your pain and your need to visit the doctor. So depending on that, they will do the triage and they will determine whether you need help immediately or you can wait for some time, and basis that they will call patients in to the emergency room. There can be a further wait inside, again depending on the triage system, but when your turn comes, there will be a nurse who will come and maybe do your blood work depending on what you are in for, and then a doctor will come and they will give you their advice. And if in case you need to go for a test, either you will do it right there and there, or they will ask you to come back tomorrow and do the tests on the next day. That is what happened with us. But overall, the healthcare system in Canada does its job until something better comes. But Canadians are really proud of the healthcare system. It's actually one of the things that they are most proudest of, and we have been the beneficiaries of it as well. So I think there is a lot of delay that can come, especially with finding a doctor, but once you have a family doctor, it does become much smoother. So in case you think that I missed out on any point about the Canadian healthcare system, please feel free to write in the comments, or if you have any questions for us, please reach out to us on our Instagram handle or via the comments down below. Hope you like this video, and we will see you again till the next time. Take care. Bye bye.